Actually, I'm Carol Hardate from the nursing department, and maybe we should just briefly go around again and say our names. So, go ahead.
I'm Johanna Freeman, and I'm a student in the early childhood department. I'm Jessica Ginter, and I'm also a student in the early childhood education department.
I'm Connie Clark, faculty in nursing.
Sandy Trout, faculty in social work.
Sarah Langer in sociology.
Wow, so we're a good example of interprofessional right around this table.
Well, I just saw that round table. I'm like, oh, I think I need to be there.
So this is perfect. I have a couple handouts in a couple minutes, but I just wanted to start maybe just describing how I became involved in interprofessional work. It wasn't by choice. I actually was working at an inner city clinic, and part of the way that we managed our health care of our mothers who were expecting was this round table that included so many different professionals. And it was amazing what could happen when we had that many different professions around the table. And that was just the beginning, and that was quite a few years ago. I won't say how many because it's too many. I'd tell you how old I am if I tell you that. But there were social work, there were financial workers, there were public health nurses, there were physicians, there were nurse practitioners, just all kinds of people around that table. And that really got me interested in what it means to collaborate and work together. So that's my little history. And then I think we need to think about why does it even matter now, and why should we think about it? And I'm going to talk a little bit about healthcare, but I want you all to jump in from your professions as well, because I think everybody can benefit from it. But one of the big reasons for health is quality. The more people that we have on the team, the more people we have around the table, the better chance there will be for positive health outcomes. And I know social work must feel that way, and I'm sure education has a very much a team approach as well. And the economics of it all. There is a cost savings when you bring everybody together and you work as a team. My current work as a team is I work at St. Paul Children's in the neonatal intensive care follow-up unit. And there it's the same thing. We have such a multifaceted group of people. We work with early childhood intervention because those babies oftentimes need early childhood. We work with social work. We work with occupational therapy, physical therapy, psychology, just a whole gamut of people. And it's not only does it influence quality, but it's an economic way to do it. And then I think the other thing that's happened in healthcare, and you all can speak from your professions, but we've become more client-centered. We realize that what we want are improved health outcomes, and one way to get that from a cultural perspective or from whatever perspective is to have a team approach. So that's really where it all came from my perspective. That's a very succinct, quick way of looking at it. These are handouts you guys can have. This starts out a little bit about interprofessional learning, but I thought it was just a nice way, it's kind of a nice summation, if you will, of how it happens. And then I'll hand this other one out in a minute, but so what does interprofessional education involve? Education and practice. There's a couple of definitions on here that I'll just call your attention to, or ideas, I think. And the first one I already talked a little bit about was quality assurance. And that's right in the middle when it talks about what's it all about. And if you go down a little ways, it talks about interprofessional education occurs when two or more professions learn with, from, and about each other to improve collaboration and the quality of care. And when I was thinking about what levels are we talking about, and I think it's the individual level, and I think any of us who've worked on a team, whether it's a faculty team or whatever team, we all bring our own perspectives. And what happens sometimes in healthcare, and I'll just use that as another example, is that one part of the healthcare team does not know what the other part's doing, and consequently there's a lot of overlap. And instead of collaboration, there's overlap, and there's just a lot of funds that are used probably that would need to be, and the outcomes are not what they could be. And so from an individual perspective, we have to learn about the culture of other professions. And it really is a cultural, everybody say something if you have anything to add here, but it's a cultural perspective, I think. The way that I view health outcomes would maybe be different than a social worker, sociology, or education. Maybe even two nurses wouldn't agree on that. And so I guess individually from a cultural perspective, it's a huge learning curve. That would be one way. The boundary issues. I don't know if you and your profession have any boundary issues, but we do. And not just boundary issues that we work with our clients, and there's certain professional boundaries, but what about the boundaries and who does what on a team? And that's a piece of interprofessional work as well. And then the organizational culture. Bethel has a culture. St. Paul Children's Hospital has a culture. I'm sure different, I don't know if you've been to any schools, but maybe you have, and you've sensed a different culture at each school. And I'm not talking about ethnicity, I'm talking about organizational culture. I don't know if you guys have anything to add from your perspectives. And so it's a learning curve. And so what it does when we involve students early on in education is it begins to get them to think out of their own mold. It gets them to think about who should be engaged and how that engagement could influence not only their own learning, but the outcomes, whether it's education or health or whatever it is. So that's just really important. And then the systems level. Policy making. I mean, a lot of us would agree on some policies. Some of us would disagree on a lot of policies. But the involvement, the whole organizational piece of policy making, and how do we come together to work together to influence. Health and education go hand in hand. Unhealthy children don't learn, and if the education process is not what it should be, they're not going to learn either. So we work hand in hand, and a lot of the services that are provided are certainly interprofessional, interdisciplinary. So if you'll just take a look at this, I thought this is from our colleagues in Canada, I believe. But if you just take a look at this little drawing here, it's just kind of a way to envision how we might start. And I want to hear your stories because I bet everybody around the table has been involved. Years ago, we called it the multidisciplinary team. Do you remember that? And then do you remember the term interdisciplinary? And now we've moved to this new term, interprofessional. So you can exchange that central term however you want. But it just kind of talks about where do you start? And, can it happen here? Who are the learners? And the logistics of it are pretty incredible. What are the resources? Identifying core learning across professions. That I think we have to start thinking. Samuel and I actually did some research looking at access to healthcare from a nursing perspective and a sociological, anthropological look. Two different ways, two different views of viewing the same thing. And then can we, let me ask it that way, can we decide on learning outcomes? Because that takes collaboration early on too. What is it that we want to do? How do we want to collaborate? And then facilitate those learning activities. And then, of course, measure and evaluate. And once we do that, we know we have to improve. And I think sustainability is huge. Just for a minute, I'm going to talk about our community engagement. And I would say one of the largest challenges would be sustainability of that. We have about 43 sites. And so if you can imagine having students over 5 semesters, and that's anywhere from 6 to 15 students at a site, and being able to sustain that over time, that takes a lot of effort on the community partners initiative, and it takes a lot of effort on faculty and student initiative as well. And so sustainability is something you really have to think about from the beginning. What's going to be sustainable? So I want to talk just a little bit about the interprofessional piece that came out of our community engagement, and then I really want to open it up to have a discussion and questions. But when we started the community engagement process in nursing, it was decided long before I came, there was a lot of hard work that went into it, and it was decided that it would be over 5 semesters. So our students start in the sophomore year and they go all the way through the senior year. And nursing is pretty direct in what it has to teach in order for nurses to pass the NCLEX. And so how are we going to make this work to put them in an experience in the community that was something that was absolutely, that they were not used to and totally out of their comfort zone. And by that I mean they were going into maybe into an ethnic area that they had not been in before. They were going into working with teachers, social workers. Some of them were working with crisis intervention workers. Some were working with teachers. Some were working with domestic violence, case managers. These professions are something that nurses had not, at the stage of where they were in our program, had any experience with. And so not only was it from a cultural perspective of whatever ethnicity and race that might be there that they may or may not have had exposure to. But it was, again, the professional exposure that was different, and it was also just the organizational culture. So those were huge. So who did our students begin to work with? Well, there were lay ministers, there were pastors, community leaders, volunteers, and there were, again, social workers and crisis intervention workers, and I think I mentioned the domestic violence program directors, teachers, just a whole gamut of professions. And let me just say that there was a huge learning curve, because can you imagine, not everybody answered our emails, not everybody returned our phone calls. You know, not everybody saw that our objectives were as important as they were to us. And so it really had to be a collaborative process with the community. And part of that collaboration had to be interprofessional. There really wasn't any choice about that, because nursing could not set the standards and expect people to do exactly what we told them to do. Instead, we had to engage them and collaborate. And so that was a huge learning curve. But I can say we've graduated two classes now. And so we're working on our third, and I don't know, Connie, you can comment. You're a faculty liaison. What do you think, how it's going?
It is an excellent learning experience, and it's so much broader than we even thought it would be. Just this afternoon, one of the students in one of my groups came in with a problem that had arisen about communication and social media and what should be done. And I don't want to go into too much detail, but they had some orientation at their site, and yet some of the individuals they were working with were kind of seeing it differently, and then they had different opinions on the students. So what should be done? So we brainstormed, and she problem solved, and as a result we'll learn and grow in problem solving and ability to relate to actually a social worker,
okay,
and collaborate with this person on solving that problem. So they do. There's just continual opportunity to grow by interacting with another profession, and that's some outcome we weren't aware of until it happened.
And the leadership, I know you've mentioned before, the leadership that you've seen some students take, that they probably would not have had the opportunity or even the initiative, but in this situation, they've really taken on a leadership role and worked with other disciplines,
Absolutely.
and other professions, so that has been a real advantage.
We keep letting them know this is part of the learning. You know, they're so quick to want to see results or just outcomes that they can measure, where just the process itself is a wonderful learning opportunity.
We have a term called embracing ambiguity, and we say that over and over again. Let's embrace ambiguity and work our way through this. And so, but any other perspectives of interprofessional experiences you've had, or questions, how it might fit education or anthropology, sociology, social work?
Well, my own experience, there's something I publish on interdisciplinary studies, and sometimes they have a nuanced differentiation between multidisciplinarity and interdisciplinarity.
Yes, yes.
Part of the difference is whether if I leave my discipline, because interdisciplinary studies is determined or is driven by a problem, not by the discipline.
I see. Okay.
So, like, it's not what my discipline says, but here's a problem out there, and then we ask ourselves, what information do we need to solve this problem, and where do we need that information? And then we pursue wherever that information, if it is in nursing, if it is in geography, history, yeah. But the idea of interdisciplinary studies is you don't just go there and then do the thing and then come back, but
That's right.
what you learn there should be synthesized so that it produces a certain level of understanding that transcends the different pieces. But then when you bring that information back to your discipline, it helps you rethink again. Not just keep your discipline the way it is, but okay, I have learned something in nursing. Okay, if I bring it back to my discipline, does that help me re-examine? So that kind of growth then, yeah.
That's a great example. Yeah, absolutely.
And for me in my professional world, I have never been only in a social work setting. So always worked alongside psychologists and social workers. We come at the table with different perspectives, or schools, or medical, within churches, within communities. So social workers are always aware that we're in a host setting, whether it is the community they were in or the agencies or organizations we're in. But the idea of working on the best for the community, if the community is the client, or for an individual or for a family, and bringing that team together is the art of it. That brings the right science to the table. And I think there is lessons to be learned in what we give up as far as what is the right answer, so that we can come to an answer together, or we can come to a direction or a consensus of how to proceed. And it's usually a blending of various things. But people ask different questions. So for me,
You get a whole new perspective.
yeah, and who is the? It's always interesting to look at who is the typical person or discipline that's in power in that situation, and then how do we respond to that? How do we work with that to lessen that power so that it has a chance to have its own power as an interprofessional gathering?
That's absolutely huge, and I think the whole boundary issues and traditions. What have been our traditional boundaries, and what have been even our traditions that we've held on to that has enabled others to have power, or perhaps for us to have power that we should not have. I think I hear two really important things. One is that the growth that it allows us as faculty or our professionals to embrace because we do it, and then two things really from you. One was the advantage to the community, and then recognizing power and how to, what's the right word, distribute that power, or
realize it well, and realize that the interprofessional team has a greater power.
There you go.
And you said that earlier in your orientation.
That's a great way to put it.
I think it takes a strong leader to be able to give voice to everyone and to watch for that power differential in community, interprofessional education. And it brings in two ethics. You know, what we want the best for the group, whatever that group may be, and that includes hearing each other. And
centers back around an ethical issue. And I don't want to get into a long discussion about this, but certainly in the media, the whole Ebola and how many people are involved in the Ebola outbreak. And it's not just health anymore. It's law, it's environmental, it's a lot. And so that is kind of right now a media blip that's looking at how we do a great case study. It's a great case study. Very complex, but a great one. Were you going to say something?
Yeah, I'll just throw in a comment real quick. It has something to do with what Sam was talking about, and Sandy as well, too. I think we have a variety of disciplines, represented here, but I think within any discipline, I'll just take education, for example, many of the problems that we're encountering are really, really complex problems. And I think historically, we've tried to answer, our questions, answer our problems within our own discipline. And I think any discipline runs the risk of somewhat becoming inbred a little bit as to what they think and how they approach things. And I think, when you look at creativity research, which I was playing around with quite a bit last year, it routinely says that you've got to bring people together from very disparate backgrounds, that are viewing situations through different lenses. And I personally would much prefer to work in interprofessional settings simply because you just are getting these fresh lenses, on all these issues you're looking at. And to me, it's really exciting to hear what a sociologist thinks about something, and what a social worker thinks about it, and an anthropologist thinks about it, and whatever, because it's those fresh perspectives. And often the most difficult solutions come by pulling things together in a unique, really creative kind of way that we're not trained necessarily to think in. And that's where I think the real beauty comes in. And that's where the challenges come, because everybody's coming from a different background, a cultural background, whatever their discipline says, however they've been trained. And to me, a really big issue in really being effective in an interprofessional setting long term, really hinges on kind of respect, for another person's discipline, but also a big part of it, what I've seen, really hinges on trust and recognizing that, hey, everybody here does have the best interest of this individual or whatever, but that whole trust thing, boy, it's always on a continuum. The trust is, you're kind of real high with it, you're kind of real low with it, or whatever. But to me, that's the real key, because that's when people start to maybe acquiesce a little bit of whatever their agenda is, recognizing, hey, you might have something to say here that could be worthwhile. And so to me, it's a really exciting area, because our problems in this world are getting more complex all the time. And, we've got to have brilliant minds from all disciplines to approach these things.
It sounds like we're talking about solving problems as professionals, which we are. And Carol, you may have already mentioned this. You said so many good things. But as students, if we start this in education, students start to get used to interacting with other professions. And especially in nursing, that's an age-old problem, that nurses are kind of intimidated by physicians, for example, and that's one of the greatest hurdles after graduation is communication with a physician. But if we could start, even with our PA program, to have some classes together and have this social worker there. And
That would be so fun. It's been on my dream list for a long time.
Don't take it off.
if they would learn those modes of communication, and that they can speak up and that we can collaborate to
have
solve
a voice.
problems.
To have a voice for the good of a greater number of people.
And the collaboration skills themselves is a whole discipline to learn. Just how do you enter into a collaborative relationship?
I think building on what Jay said, part of the problem is you're talking about the system level. Sometimes we structure our society in very competitive terms. The professions, sometimes there are some departments I've come to realize in the United States where it's difficult for the faculty to sit around a table and have a meeting because of the lack of trust. They cannot just reach an agreement on anything. They don't want to see, they don't see eye to eye. So when you structure your society, mainstream society, around competition, and then now you have a problem, you say, okay, let's come.
It's called turf and called economics, right?
It's not easy for people to reconfigure themselves. And actually in the literature, I came across this idea that not everybody has the personality to engage in interdisciplinary or because it requires a certain level of humility and being comfortable. Because sometimes somebody has to be sure in where he is or she is before they are willing to venture out. But some professions, as you say, are very concerned about their prestige. There's power that comes with certain professions, and they are concerned that if they have to listen to somebody or something like that, it's kind of like diminishing their prestige, whatever. So they would like to just be their own. But many of the problems that we have cannot be solved. In development, for instance, it's obvious that you cannot have development without taking the issue of health very seriously. Education.
Economics.
So all these things are related. The course I teach in Guatemala brings all these things together. So even if I'm a sociologist, I'm very interested in issues of health, because if you don't take care of that issue of health, children are not going to do well in school. And education helps health also.
And if we don't understand the social aspects of the culture, then we're not going to really be able to meet the health needs. So you're absolutely right, and I think taking off on what Connie said, the earlier we introduce it in the educational process, the more opportunity we have across disciplines or across professions to make a difference. If we wait till people graduate and then they've got their traditions and we've got our traditions and then we try to bring them together, that's where that's where the intimidation and the power bases begin to develop. And I think, Jay, you used two words that I like, beauty and trust, and those are two very important and precious words. And I think really to achieve those, we have to be in a place where we have the humility to get out of our comfort zone. And as you said, Samuel, not everybody has that. you know, and so it would be an unrealistic goal to think that everybody is going to work interprofessionally. But as professionals, particularly as educators, what can we do to at least bring that issue in the forefront, bring it to the table early on, and offer it to students as an opportunity? At least they've heard it, we've introduced it, and some will go with it, and some will end up maybe doing research somewhere, you know, in a lab somewhere if they choose, you know, not to. I mean, there are people who enjoy doing individual kinds of work, and
Well, wonderful research would be interprofessional research.
Well, according to the literature, the reason why interdisciplinary work is very difficult is because the pace is very slow, and if somebody gets an appointment and they need certain publications before they get promoted, it's easier to publish something if you're just operating within your discipline, because the arguments are very easy.
okay.
So, but if I have to cooperate with you, it slows things down, but it is more helpful in terms of solving problems because we're bringing all our minds together. So sometimes they argue that in universities, for instance, if we want to encourage interdisciplinary studies, we have to change the way we even evaluate faculty so that we can assign some value to interdisciplinary work rather than just evaluating people. Because it would be easy for you to publish something within your discipline, but if you have to cooperate with somebody, collaborate, it can be slower or whatever.
Especially if that person's outside your discipline.
That's right. And you have to share the same timetable. You have to agree to a timetable.
So I think that comes back to the sustainability piece.
That's huge.
Because the economics of this, and this is what I experience with our discipline, is that is it cost effective to have social workers? Can nurses do it? Can educators do it? Do we need social workers there? And so but can we afford them? And so can we afford all the voices together? And you were saying we have, I think, the idea that we have to prove that it is cost effective, even though the way to getting to the end result is different.
Yeah.
We have to prove the value of our own discipline, but I think when we come together, you start to hear what everyone brings, and so you're not as apt to say,
Right.
well, only my area
So
is.
the product that we want, or the outcome that we are all working toward, will really be economically more feasible if we can just see that where that's going to go. But that's the hard part.
I think an example of that is some of the case management now that's going on with different, I'll just use diabetes as an example. As far as the initiatives and how clinics are reimbursed, it depends on how they manage their diabetic patients. And so managing their diabetic patients has a lot to do with the nutritionist. It has a lot to do with the social worker if there are economic reasons and no resources to buy healthy food. And so in order for clinics to be paid what they would like to be paid at the highest level, they have to provide the highest level of care. And so I think now they are looking at that. I'm finding clinics who are actually taking and hiring case managers who may have a social work background, or some may even have an education background, depending on what their role is, and they're utilizing them in the clinic to do this kind of case management. So I think we may be ushered into a new phase with our healthcare insurers, because they're now saying, you know, you have to prove that you deserve this level of reimbursement, because ultimately we want to have positive patient outcomes. So I think, Sandy, that may lend some credibility, not over the next year, maybe not even the next 5 years, but I think eventually it will lend some credibility to the team model, if you will.
Aren't there some models, like what I understand of Mayo is really kind of a team-based approach. I'm really outside of my discipline talking about Mayo right now and how they operate, but that's what I've heard is one of the real pluses about Mayo. The fact that they actually have all the folks really talking together and everybody knows what's going on and they can all feed into the decisions. Is that accurate? Wouldn't that be an awfully good model to?
It would be an awfully good model. I'm not familiar with the Mayo model, but I am familiar with some of the local models. And the model that I used from the clinic that I'm a part of, we definitely try to bring everybody around the table and hear their perspectives. And that makes a difference in outcome. And so
I've heard about the Mayo folks, and talking to a bunch of people that have been there, they say everybody is on board.
Sense.
Everybody knows what's happening here. They're all feeding in to the decision.
That makes sense. We'll have to look into that. How about
students?
Oh, I'm sorry. I was just going to
I'm
ask.
going to flip it to you. From an educational perspective, one of the things that I've been coaching my students about is that many times the educational setting, well, the teacher will say, "You fix that kid," to the social worker, and I'm talking with folks about, as a social worker, how do you re-engage that teacher? Not so much focusing we'll do some things here at the child level, but we'll also create a team that's at wraparound services or case management and the teacher is part of that team rather than dividing it. And it would make sense, right? That if the teacher gets empowered in this process, the teacher's going to be it's going to be a win-win situation.
And that makes sense because I feel if teachers begin to work with social workers, they will kind of understand kind of what's going on and then how they can help that child in the classroom and how they can better, deal with stuff that's going on at home for a student or different stuff like that. That it would just be really beneficial for that. So.
And they feel really alone and worn out and tired. And that's why they say, go fix this kid. But if we can help them to re-energize in some way. So it's not so much about, we all have to have a piece of this, but we all can help each other do this because it's hard work.
That's an important point, that we don't each have to have our own piece, but that we work together to help the outcome.
Yeah, and we do have our rules and our turfs, whatever you want to call it. The teacher has to teach the math. I don't have to teach that.
Yep.
But the teacher knows that they're trained, that they have to have that child engage with them if they're going to teach math.
So it's not handing off, okay, you're on this team, that's your area, take it. But having a part and working collaboratively.
Yeah, so the teacher doesn't have to feel so burnt out. The teacher gets some understanding from the social worker that, yes, it's really hard to go through that every day.
So it's really a supportive role, too, both for, in your example, the student and the teacher.
Yes.
And, of course, the school nurse gets wrapped around in a situation, in a school setting as well. Because sometimes... And the psychologist.
Yeah.
Interestingly, while we can talk about this at the professional level, but it also applies to the leaders in this country or in many countries, because I would argue that there are many problems in the United States that could have been solved if there was collaboration between the different groups that are leading the country, but because they cannot see eye to eye, the problems remain there. They talk past each other, but with every day that passes, the cost of the problem to the United States is increasing. And then after about 5 years, what could have cost much lower now costs more, because they are just arguing among themselves, they are not solving the problem. So, and the whole challenge of whether every politician has the capability to engage in this collaborative work, to see the problem more than their own turf, like my identity as a member of a particular political party or anything, or whether this is a problem that we all face, and no matter where we come from, we should work together, no matter what our background, to solve the problem. So,
I'm sorry.
Well, I wonder if I could throw a question in. So,
Okay.
A quick observational question, tell me if not. But going back to what you were talking about, Sandy, about how, Sam, you were talking about a competitive society that we live in now, which is very true. And then you were talking about the need to really kind of build those collaborative skills. And one can't just assume, that our students at Bethel have those skills, or adults that are out there have those skills, because clearly a lot of them don't, in some ways. But my observation has been in the social work department. My daughter was a social work major and had Sandy and went through the program. And I watch how she operates, and it's like just amazing to me how she can get 5 people in the same room, and they're all working together. And it's stuff that she does, stuff that she's learned kind of how to do. So I'm curious if you could maybe, in a nutshell, talk a little bit about how you go about trying to build those collaborative skills, among social work majors, and I'm sure some of that's probably transferable to other majors. But how do you do that? Because that is like a really critical part of what you guys do, and it's like a really big part. And so how do you...
Survival skills for us.
Yeah.
That's what I was saying earlier.
Yeah. So how do you go about doing that?
If we could change the world and be in charge of the world, maybe we would, but we can't.
Well, I think it's simple things like kind of you were just talking about your little group, your team, that your group of students that you're helping them to walk through that. I think that's built into we're always in the community engagement piece. That's just part of our program. But I'm realizing that I'm telling students, especially this semester, even with me, like, don't hesitate to come talk to me about that. The one skill I want you to know is collaboration. And I just from day one start talking about that. So it's about all of our relationships. And yes, there's a time when it won't be a collaboration anymore, and building whatever assignment it is that you're doing, let's put our two heads together. You have information, and I have information. There is a power differential, for sure. I am the one that's going to do the grading in the end. But there's something about breaking down some of that fear. And then, students are individual. We have an individual orientation. They always say, it's easier to just do it myself than to work in a group. So I watch those group skills from freshman to senior year develop.
We even try to teach some of those group team building skills and the roles of the group members and even the stages of group formation. Both Carol and I are teaching public health nursing to the CAPS group this fall, and they are learning about collaboration in the community and how they find assets. Who are the assets to solve or to address a strength in the community, make it better, or to help with a problem. And then they need to pull these assets together, whether it's a school, a community center, a church, so many different partners coming together. And then they form the group, so it's a forming, and then they storm, or they think, what are the rules here, who's going to be lead here, and then they kind of develop the rules, and they norm it out, and then they work and come together. And it's a long process.
Painful at times as well.
Yeah.
It's not an easy process.
But they're learning.
They're learning, yeah.
Those skills of working in a group.
And I think the social work skill of engagement, and you have that as well in education and nursing, that we should start there. Let's just talk about, we don't just engage the student, but we engage our colleague. We need to know how to do that. I think that's sometimes a hard one.
I don't think that, and maybe you all will disagree with this, but I don't think you can teach humility. But I agree with Samuel that that's an important characteristic. And so if you can help the student recognize the need for humility and to develop that. And the other thing I would say is the whole piece of being a partner with the community, that we are not coming in to rescue a community, we're coming in to partner. And then I think to see community as teachers. We have many community members that we engage with who do not have advanced degrees, but they're very wise and they have a lot of knowledge. And for early on to have the students recognize that knowledge and their contribution to not only their community, but the students' learning, I think that's huge because it sets a very early paradigm, if you will, for students to kind of progress through the system.
And in a way, it's free because you don't have to come in with all the answers.
That's right. In my different class, that's why I'm telling you, really, it's going to be great once you figure out that. I think person and environment is probably our core piece that we start teaching from the very beginning. So it's recognize that all of these pieces, the community, the culture, the different intersections of people in our lives has an impact on us. So it's very systems oriented in that way. And I think nursing and education have the skill that you're building for your technical skill, and then you're putting those other things into that.
Well, I think you use the term the art and science. There's a science to what we do, but there's also art. And so it seems to me the science is probably more easily taught than the art. I think the art is a lived experience, if you will. It's a gathering of experiences over life that makes you who you are, and the art of how you do your profession. And I'm not sure how we're able to necessarily teach that, other than to have students recognize that there really are more. There are several components, and certainly the art and science. I think that's true of probably any profession. But
well, some people would argue that some of the best ways to teach certain things is for the person teaching it to incarnate those qualities, like humility, for instance.
oh, you think you
Yeah.
can do that?
Well, if I'm working with you and I respect you very much, you're my boss. Like if our dean or provost or whatever will do something which suggests humility, without telling anybody, it may be difficult for somebody to think, oh, if you have somebody who is way over you do something. If you respect, I don't know, my African culture might be influencing my thinking here, but in traditional African society, you respect people in authority, you respect people who are all elderly, and if they were to do something out of humility, it would just be difficult for you to think of behaving otherwise, because these are people you respect, and they've done this, even if it means putting yourself to do something that you think is below you. But if somebody ahead of you has done that, you have no excuse to say. So
That's a good point. That'd be teaching almost by role modeling,
yeah, but it's
or
not,
mentoring, right?
It's not easy.
No,
I don't think the leaders now in Africa behave that way.
Very good
Sort
point.
of like that's about giving up some of that power.
Yeah, it is. Not sure that the Westerners are quite ready for that. This is. Did you have anything to say before I move on? Okay. I just brought this just for a very quick overview, and I can give you the link if you want any more of this. But this is just, when I did a presentation earlier, or maybe last year now, talking about interprofessional practice in education, just competency domains, and they only mean what you want them to mean for you. But if you look at the ones that are listed here, their values and ethics, I think, those are pretty general. Roles and responsibilities, we talked a little bit about that. How do you communicate interprofessionally? I think we've already talked about that a little bit. And then teams and teamwork, and Connie talked about that too, about building team building. So these are the domains when you want to think about, at least a beginning place, to think about interprofessional education in practice.
And I see that the American Association of Colleges of Nursing is one of the sources of this. That is our accreditor in nursing. And they are calling for interprofessional education. So, in fact, as we're preparing for our next accreditation visit, we are looking for ways we do interprofessional education. And we're finding that. But we're being intentional about pulling them out and saying, this is it. This is how we do that. And it's good for us.
I think that's a really good point, because it may be our accrediting bodies that eventually say, hey, the expectation is that you'll step up to the plate in this area. So when you've got that kind of...
I understand Minnesota is one of the leaders in the nation in professional relationships.
Yeah,
What happens in the education world is kind of interesting, but in terms of kind of teamwork, I would say probably 85-90% of schools right now are approaching achievement data, through using, they call them professional learning communities. And that is really how much of that data is really getting unpacked, within a given district or within a given school. And typically on that professional learning community, you've got people that, are classroom teachers, you've got administrators in there, you've got an EL person, you've got a special ed person, you've got a school social worker. Sometimes you'll have a staff member of the school, that'll be there. But, your future, as you go on in education, is being a member of a professional learning community. But it's interesting how they structure them. They're all structured around the idea of looking at achievement data. So that's kind of our problem. We've got an achievement gap here, based on race or based on gender or whatever, and we're approaching it. But it's not just healthcare, but it's obviously everything we're talking about here. But it's huge, in the field of education. But what we're trying to do, like in the ed department, we're running. You'll hit. I don't know if you guys will hit block 2, but this is the period right before student teaching. We're now running 3. We call them professional development days. And it's an entire day where our students come together, and all of us as professors are there. we had to plan this day together. And our first one was on lesson design. We just finished one this past Friday on assessment. Our next one's going to be on differentiation. So we came together as faculty members, ed members, all from different backgrounds. I'm a literacy person. This is a science guy. This is a math person, whatever. And I would say we've spent 3 days planning one day, of what it's going to be for the students. But it's been so good for us to have to really understand what one another is doing. And so we all co-teach. We're all teaching that whole day. We're all planning that day. And I think it's been great for us, to understand what our colleagues teach and what they believe. And, some of us might think we're like kind of the expert, in assessment. It's an area I'm pretty good at, and I'm realizing, hey, there's lots of really good things here in our department and other ways of thinking about things. So it's been, humility has been involved in it, in a lot of ways, but really forced collaboration. We made ourselves do it for the benefit of our students. But for our students to see us all teaching on the same thing, slightly different, but still having respect, for one another, it's been, I think, a really important role model. And I know there are departments sometimes where there can be, professors kind of pitted against other professors and some of this, and so we've really tried to work on that and say we all have something to contribute here. So it's been a really fun approach for us, and it's all been, just the interprofessional type thing.
I think that's a perfect example.
And I don't know if we could have when we have Frogtown, but something like a school within a community that has health, public health in it, it's like all of it together, and have a team that works on that.
I think that's a great idea. And I'm sure there are some schools that would be willing, because with the achievement gap.
Well, and with the Promise Neighborhoods, that's one of the...
Exactly.
If we could, and I've talked to, thrown it around a couple times, but it's hard to get... It takes work at the front end to get all those players involved in that.
Could I ask a question, Jay?
Yeah.
With regard to closing this achievement gap, sometimes what I see is a school is penalized when some students don't do really very well.
Yeah.
But if you look at the fact that there is socioeconomic inequality and it is highly correlated with students' performance in a significant way, and then you have immigrant children, and the school in America is where we assimilate those immigrants who come in here. So in that sense, many of the schools are performing an important social service for building this nation, because it's not just educating people, but you're really making them to become part of this American culture. They learn the language, they learn all those kind of things. And of course, their performance is going to be a little bit sometimes lower than, but sometimes when I hear a discussion on the public radio, nobody appreciates the social service that the schools are providing. We just evaluate it in terms of the test scores are not really good. When I came to this country to start my graduate studies, of course, it was a huge struggle, because it was the first time I was living in Africa, and in my country I was living in a rural community, not even a big city. So you think about the amount of struggle some of these immigrants really go through. But we just look at the numbers. So does anybody try to understand with the schools that they are performing this?
Yeah, I think initially when we started, we've had to talk about the achievement gap for a long time, but I think initially when we started looking at the achievement gap, we were looking at it in very simplistic terms. We were saying this school has X percentage of students at a proficient level, and of the white population, X numbers at the proficient level. Within the Hmong population, it happens to be this or it happens to be that. But I think we're getting more sophisticated in looking at the data now, and I think what a lot of schools and what a lot of good educational leaders are advocating is the importance of looking at growth, and not just looking at are you proficient or are you here or are you here, but really putting more emphasis on what kind of growth is occurring. And in the past, if certain schools didn't have students, X number of students at a proficient level, they were put on probation and bad things happened to them. Their students were sent elsewhere and all this. And still, some of that does happen to some degree. But now I think we're getting much more savvy. We're recognizing we want to see growth here, and that's what we're rewarding. Because often, student success is often based on socioeconomic status. I mean, it's very clear that's what it is. It often has nothing to do with the quality of the teaching that's provided or the educational system. It's like where you come from. That makes a difference. So I think we're getting better in some of that, which to me is really encouraging, because we should be looking at growth. I think that's what's most important.
Carol, I thought one important thing here that among the three is interprofessional communication.
Yes.
I think this is really, really very important, because sometimes when I attended one conference, the Society for Business Ethics, and I'm not trying to whatever, but the guy said they were having an interdisciplinary team, but the economist left because he couldn't cope with he's too rigid.
So I just laughed.
When you want my opinion, call me back. But other than that,
because you see, I don't know whether it's because of my immigrant experience or whatever, but I watched a lot of documentaries, and I found out that if you watch Nova, how is it that many of us are not scientists, but a scientist can take a very complex idea and communicate it to a layperson who doesn't have background in science, but still be able to understand, okay, this is what they're trying to do, and I appreciate what they're trying to do, even though I'm not an expert in that area. So I think interprofessional communication requires that every one of us tries to find a way to understand something in our professional language, but also to be able to translate it into a simple language, so that even if someone was not trained in our discipline, they will be able to appreciate it. They can disagree with it, but the important thing is for them to be able to really clearly.
I think that's an excellent point, and I think that certainly is something we need to pay attention to as we educate our students, is the communication piece. Because you're right, Jesus did a good job of it, didn't he?
Oh, yeah. And Apostle Paul.
And the Apostle Paul as well. So we have some great role models to follow.
It's an educational dilemma, because we spend 4 years teaching them all our vocabulary, and then when they're ready to go out the door, we say, and now get rid of it, so that you can talk and work and be involved.
I attended a motivational interviewing seminar a couple of weeks ago with my public health students, and the speaker said, we all want you to quit your jobs. And by that, he meant stop trying to get people to do things. Stop trying, hear what the people are saying, which is what we're really talking about. Listen to the stories, hear what there is to hear, and then move from that direction with the person, not the talking to, not listening to. And so I thought that was very interesting. So maybe we not only need to quit our vocabulary, we need to quit our jobs and rethink, not literally our faculty jobs, but rethink the way that we communicate and the way that we do things. So
it's very interesting when I haven't been a medical social worker to supervise somebody who's a medical social worker, because that all of a sudden I can hear the pressure to get this job done, and I'll have to say, so what did the patient say? Because you're so used to getting them. Discharge planning is this thing that a social worker has to do.
We know about that.
The social worker is your best friend.
Yeah. You care. But I mean, they have a lot of pressure to get that discharge plan done, and not, or get that kid back in the classroom all fixed. Yeah, interesting stuff. I think it's so. I'm just appreciative that we have these. That we're working on this.
Yeah. Thank you all for coming. It's really a fun topic, and I don't think there's necessarily, right or wrong answers, but there's a lot of room for discussion and just thinking about where we go from here and what we can do, and it's just very exciting. So thank you all for coming and participating, and I learned a lot.
It's interesting. To me, it's interesting just to learn about other disciplines.
Yeah.
It's really interesting.
So how often do you organize this, Jerry?
We do a roundtable once a month, and the topics really vary. They really vary. We've done. I've been doing it for a number of years now.
So what is the difference between this and another presentation going on?
There's an iStudio going on right now,
Yeah.
and April Schmidt is running that. That's kind of a new effort that we're running. It came out of, we ran some innovation groups last year, and so it's an idea that's springing from that. And the innovation groups, it's typically a different faculty member or a different group that are coming to present an idea. And I'd be hard put to talk about what the exact difference is, because both of them are designed to be very interactive. Yeah. So,
Well,
I'm not explaining this well at all.
Well,
You did well, James.
I'll be looking at the Bethel, is it e-news or what do they call it?
Right.
That's where I see some of these things.
Yeah. No, that's very interesting. Yeah. We try not to overlap.
How are you doing?
We're
Fine. I was stopped by one of these days.
Would you? That'd be nice.
Yes.
Right now,
Thank you.
Give me an email.
Okay, I'll do that.
Take care.
So
Thank
one of our
you.
assignments is to go to a cross-cultural event or talk or anything. So she had emailed us and said that this was going to be going on for them to go join. We're just going to see.
Are you guys involved with the King Child Development Center at all, or are you?
What we will be next was
Okay.
We have nursing students there. So when you guys are there,
You'll be doing
nursing.
Interprofessional.
You'll be doing Interprofessional.
Yeah, because right now we're at the CDC
Yeah.
for this. Yeah, and then we'll be moving to King next semester.
You're going to see two totally different worlds.
Yeah.
Totally. And it's great that you can see that.
And when I look at healthcare reform, I think about all of the, and it's not just healthcare, I say that because I'm familiar with that terminology, but really where the dollar is being put is early childhood.
Yeah.
You know, and definitely the early childhood programs are just really...
Well, they have the biggest impact.
Exactly.
Yeah.
Through their life.
And now there's enough data out there and enough research, which I'm sure you all are quite familiar with, that's very suggestive of what a difference it makes.